business projections as well. We have another fun fact for you this morning. The United Nations is projecting that those who venture into poultry business would have some gains as there's an increasing demand for meat and eggs going into 2025. It also speaks to the nutritional value of our diets these days. Well, in the studio this morning to talk about the new year, new you, with a mindset of prioritizing your health and well-being is Dr. Matthew Okoh, who is a physical health researcher. Good morning to you, Doctor. Nice to have you on the program, and Happy New Year to you as well.
Happy New Year to you too. Good morning, and thank you for having me. Good morning to your viewers as well.
Well, it's the talk and conversations about the new year. Usually people talk about new goals, resolution, or whatever makes their year worth looking forward to. We often forget our health in these conversations. People project how much they can make this year. People talk about how much they want to achieve. We relegate the conversations of achieving good health. But the conversation is pertinent now when you look at the price of affording health care or even buying medications over the counter. Where do we begin this conversation from when we talk about a new year, new you?
The fact is, the greatest resource that any person can have is, his or her health. Because if you are unhealthy, there's really nothing that you can. The plan to, make more money, the plan to achieve whatever good that you have achieved, cannot come to light if you are on a sick bed. And, just like you have mentioned about cost of drugs going up, it's more than tripled, even quadrupled, in recent times. So you really cannot afford to fall ill at this time, particularly, in this country that we are at the moment. So the best thing that any person can do for himself or herself is, to plan to keep him or herself healthy by, making conscious decision, taking active steps to keep themselves healthy as much as they can. You really cannot, guarantee yourself anything, right? But you need to be seen to have done your best. As simple as that.
Now let's talk about these steps. We hear, and it's common knowledge, that the first step to being healthy is a healthy diet. It starts from what we ingest as food. But the challenge now in Nigeria is with where food inflation is and the price of commodities. Many households will tell you they just manage to have daily bread, which is not a balanced diet. Are we certain that Nigerian houses can find a way around balancing their diet as best as they can to eat healthy?
Okay, so first I will underscore the importance of nutrition, right? Because it's the foundation of an individual's health is laid right from when the person is in the mother's womb. Seriously. So the nutritional status of the pregnant woman, to large extent, determines how that child is going to turn up later in life, as an adult, with respect to his or her health, chronic health conditions, and that from pregnancy up to when that child is 2 years old, whatever damage that is done by by the virtue of not enjoying adequate nutrition, can hardly be recovered after the age of 2. So having said that, when we're talking about balanced diet, we often, there's poverty right now in the land, right? People find it difficult to eat. But like I said earlier, what you need to do is to do the most that you can with what is available to you. And people are able to eat, whatever it. Okay, so let's go back this way. People oftentimes see people eating what in quote we refer to as junk. But if you look at trying to eat healthy, because people tend to equate balanced diet to something that is expensive. It does not have to be expensive. We cannot take out the fact that it is the economy is not the way we expect it to be or we want it to be. But people see, if that's the little that you have that you want to manage to eat, you can also use it judiciously. So somebody can take gari for goodness sake. Gari and groundnut has its benefits to you. So somebody may look at it as not balanced. For example, when children are weaned off breast milk, right, and the we start complementary feeding. One of the things that is recommended, right, is pap mixed with groundnut paste. It is completely nutritious for that baby. So what am I saying? Whatever it is that you find to eat, you can make the best of it to as best. You can't possibly get more than what you're able to afford, right? But little that you are able to get, you need to take that conscious step to make it as useful as it is to you, compared to somebody wants to eat shawarma, right? I mean, that money can do you good if you are taking something that is the essence is something natural.
A substitute that is more natural.
That is more natural. That is packed with nutrients. That is good for your body. That is what we are talking about when we talk about balanced diet. It doesn't have to be something expensive.
Now let's talk about some of these substitutes in terms of animal proteins and plant proteins, like you've mentioned, especially now when half a crate of eggs is well above 3,000 naira. What are some of these plant proteins? I know you've mentioned groundnut paste that people can use to substitute and still have a balanced diet.
So I just talked about groundnut paste. I mean, that is what we commonly recommend, right? But yeah, crayfish, people will say is I hear now from people who say that it has become expensive. But crayfish is also a good source of protein that somebody can use. Fish, yes, has become expensive, but the fact is that you can get depending on where you are anyway. I mean, like for example, we keep talking about people who are in the rural communities. Again, you can very easily find these items, no matter how maybe pricey we may think they are. Getting those items, fish. You don't have to eat meat. I know they say fish is competing with other lean protein, as we want to call them right now, but you can make do with crayfish. Crayfish is also something that we recommend for you to blend and add to your child's cereal when the child is being weaned off breast milk.
Now, it's important that you stated that some of the damages in terms of the lack of adequate nutrition or diet through the formative years up until 2 years is hard to correct. But now, away from that demographics of persons, talking about adults now who are managing certain health conditions, prioritizing their health in 2025, in a year when medication is high, what are some steps that they can take to ensure their wellness?
So, I mean, usually for people who have chronic conditions, like, I mean, the commonest things that come to mind is, diabetes, hypertension, right? You will, if you know any person with such condition, you see that one of the mainstay of management for those people is, physical activity and then dietary changes. That is usually, in fact, the first step to dealing with those issues is, recommending dietary changes. When that, or lifestyle changes, which include diets and, physical activity, it is when that is not now, meeting the target for management, then you now introduce pharmacologic therapies where you now begin to give the people medication. So, eating healthy, we cannot run away from that. There's no way we can run away from that. So, eating healthy is very, very important. And again, we are not just talking about the food that we, in terms of the bolus of what you have in your plate. We have fruits and vegetables. Now, these things are available to us all year round because every time of the year there are different fruits that are in season. So, and when they are in season, they are a little more affordable compared to when they are out of season. And then you have vegetables all year round that people can go to the market and buy. So these are really very important component of when we talk about the balanced diet because they tend to help to boost your immunity. 1, 2, they help you to, there's what we call free radicals in the body and then chronic inflammation that goes on in the body because we are exposed to all manner of, let me use the word for want of a better word, insults that challenge the body. So these are the food elements that are able to provide the antioxidants that you need to counteract the effects of these insults that the body experiences on a daily basis, and then they help you to mitigate the effect of some of these health challenges that people come down with. And also talk about the effect of exercising. The human body, is not designed to be sedentary, so you need to be active continuously. Actually, as of today, the recommendation is a minimum of 2.5 hours of moderate activity in a whole week, so which can be broken down to 30 minutes in a day. You can do 10 minutes morning, 10 minutes afternoon, 10 minutes at night. You do not have to do the 30 minutes at once. You can break them down.
Now, in achieving this balance in lifestyle, and we've started from the place of diet, you've also brought in the place of exercise. The challenge with our lives and the way it is that a lot of people get caught up with the stress of trying to achieve goals, and they forget to do these two basic issues you've pointed out. Now, in dealing with stress, are there other recommendations you can advise that people explore in the event that they are beginning to experience stress or fatigue?
So the one thing that we often do not take note of is the fact that there's a lot of stressors around us. We need to be mindful of that and take steps to really mitigate against being stressed, really, because it does numbers on your health, really, where you are chronically stressed. So you need to take time to rest. See, the concept of people going on leave from work is not just because the people who came up with those concepts didn't have something else to do. It's not just because people want to go and enjoy, right? The idea is for you to take a break from, having worked for a period of time. You go and take some time off from work. People do what they call retreats, right? They go somewhere, block out all, distractions, all forms of requests on that demands on your time, right? And then you just take a quiet time, take time to rest. There's a reason why you are supposed to go to sleep at night. When you go to sleep, that is when your body is able to rejuvenate from the stress of the day. We hear people say, motivational speakers, that you don't need to sleep more than 4 hours in a day. For goodness sake, that is motivational speaking. You need a minimum of between 7 to 9 hours of sleep every night for your body to reset itself for the next day. Very, very important that you must take time to rest. Rest is one big thing that you need to do. Funny enough, exercise also has a way of distressing you that many people may not understand or may not know. So, taking time to rest, taking time to exercise, taking time, making social interaction, getting along with people, forming a social network that you can hang out with and do nothing else other than, just gist and, talk about and laugh. Laughter, they say, is good medicine, right? But we often take these things for granted because maybe we just do not understand how important they are to our health.
I like the part that you mentioned, social network, and this is where a lot of people somewhat succumb to the temptation of choosing lifestyle choices that counteract the initial reasons why they should have social networks. Now, we look at some lifestyle choices people take where they indulge in consuming alcohol or smoking that also further endangers their health. With the challenges, most times people say for alcohol, a little wine here or there is good. How do we treat these conversations going into 2025? Is there moderate drinking, socializing responsibly in order not to endanger one's health?
So I think this categorization that you have made is actually very important, right? Socializing responsibly is, like I said, it's taking deliberate and conscious efforts, to take care of your health. But I've been saying that I am a product of my father is a retired personnel from the Nigerian army, and I grew up in the barracks where I have peers who smoke and drink, but I don't, right? Again, but not everybody is the same. So people are very easily influenced, right? So I'm just saying that to say that you can, if you make up your mind that this is what is good for you, this is what you want to do, to a large extent, you probably will be able, to keep to it. Now, coming back to the issue of drinking, the truth is, or let me know, the fact is, there is no level of alcohol that is safe for anybody. If you look at the website of the US government, the government of the UK, I believe the Canadian government, you will see where they talk about alcohol. You will see where it is written, something like a caveat emptor, that even though, because they cannot stop people who want to drink from drinking, moderate drinking will reduce the risk. Not that it eliminates it completely. It is clearly stated there that there's no level of alcohol that is safe for you. So I know that this concept of moderate drinking came from a study, an ongoing study that, sometime in 1963, the Framingham study, as they call it. And of course, after it was reviewed, found out that, the study design was actually flawed, and so that recommendation was, was also as well flawed if the study design is, was flawed. What the benefit, the perceived benefit from, the wine that they talk about that is good for the heart is the products from, or the chemicals or the agents that tend to confer that effect, the helpful effect that they talk about, actually are byproducts from the plants that we use to manufacture. Wine is a product of fermentation of sand, like grape and all that. So those ingredients are from those plants. So if you are drinking because you want your heart to be healthy, because why not just eat the plants straight away instead of taking alcohol? Because for every ounce of alcohol that you take, it takes something away from your liver, whether you like it or not. So the fact that, the one thing that people do not understand, that the liver is able to cope, is able to accumulate fire, because the liver is one organ in the body that is able to regenerate itself up to certain limits. So we tend to take that for granted. So bottom line, no level of alcohol is safe for anybody. Same thing, of course, everybody knows about smoking, so there's no need to belabor that.
Now, let's talk about another angle of lifestyle choices. And I know there's studies, some would say in the negative or not, especially as it affects men and women with sexual reproductive health. We've seen some people go viral for talking about the number of times in a month a man should ejaculate and whatnot. The conversations on safe sex in a society where there are prevailing STDs and STIs. How do you preach this message to someone in 2025 in keeping with their sexual reproductive health?
Well, I guess we probably will begin to think about maybe a channel or strategy, but bottom line is the message remains the same. Stick to one faithful sexual partner where you're unable to use protection. Condom is the widely acceptable means for now. We have both male and female condom. However, what people need to know is that there are some ailments that the condom cannot, or infection that the condom cannot fully protect, cannot protect you against fully. Because no matter how, there are certain parts of the organ, right, that will remain exposed even when you put on the condom, right? And then there are those infections that all they just need is, coming in contact. That is all that is required. So as much as you want to flex or maintain steeze, whatever it is that they call it, you need to know that you take active step to protect yourself. Again, like I mentioned at the beginning, you just need to make that conscious decision, and then you take the step to consciously try to keep yourself as healthy as you can. With respect to ejaculating 21 times. So there are studies out there, but in the healthcare industry, right, the standard for making recommendation is results from what we call randomized control trials, right? And in this instance, most of the studies that we have seen in this this field that we're talking about right now with respect to number of times a man should ejaculate are all observational studies. So, and the balance is that correlation does not equal causation. So, the Nigerian Urological Society came out not long ago with a position statement to this effect, that there is, at this point, there is not enough evidence to make that recommendation to anybody at this point. And having said that, if really ejaculating 21 times in a month is the way to keep a man safe from prostate cancer, why do we not have an epidemic of prostate cancer among people who are eunuchs?
That's a good position. That's a good position as well.
So, and I mean, beyond that, there are other things that you can do. For example, we have anthocyanins, we have lycopene. These are antioxidants that you can find in tomato, watermelon, and other foods that have protective effects
against prostate,
against cancer generally, and some against prostate cancer as well. So, why must you? I mean, so we may not be able to determine people how they want to live their life, but the point is, make sure that people have enough information for them to make an informed decision. So if these options are available to you, so the point is, the issue of 21 times a day has not been, confirmed. It is not a position in the medical community. Like I said, the Nigerian Urologic Society, which is the umbrella body for all doctors who are specialists in the area concerning the prostate, this is their position on the matter. If that is their position, then we shouldn't be, prescribing that to people, right? And then two, if we are not prescribing that, are there other options? Yes. So exercise, like we said, exercise does a lot of wonders. And then two, the consumption of fruits and vegetables with this and antioxidants that are able to also confer protection on the prostate gland. The prostate gland, so long as you're a man and you have a prostate gland, and from the age of 40, the gland begins to enlarge, whether you like it or not. We don't know why that is today. Maybe tomorrow, next tomorrow, somebody may come up with an answer to that question. But the fact remains that the prostate gland begins to enlarge, and with that will come some of its problems, right? For some people may not be unlucky enough to have it enlarged to now needing medical attention, right? But it does not take it out. Whether you have sex 50 times in a year, you ejaculate 100 times in a month, rather, it does not change the fact that your prostate gland is going to get enlarged
at 40.
It begins to enlarge as you get to 40 and above.
Yeah. It's important to hear you give respite to some people who were thinking how to meet up that 21 times a month, especially with a worrying editorial posted earlier in our newspaper review by The Guardian on the worrying indicators of a rise in teenage pregnancy. Now, this has become another worrying challenge in society. Often people don't talk about it, but we now see more teenage girls getting pregnant. You ask, is always someone close to the family that is responsible? In going into 2025, are there better approaches at the family level? Can society do better? I know there are VAP laws in some states that prevent, because most times they say it's as a result of rape in some cases. How do we holistically tackle this issue with a worrying rise in teenage pregnancies?
So oftentimes we are afraid, I don't know if that is the right word to use, to engage in this kind of conversations, right? We need to continue to have this conversation. Sex education is something that is really very important. Whether we like it or not, we tend to want to shield our children from certain information. But the fact is, we are in the internet age, right? People have phones, tablets, they have access to all manner of information. So we as parents, we as a government, as a society, we need to begin to have this conversation. I'm not sure where the conversation is in the schools right now, because at some point there was this debate about sex education in schools. We tend to do a lot of censoring, right? But I think what we need to do is to help these youngsters to understand what is going on, because they are definitely going to explore. So it's to help them to understand what is going on with their body, what they need to do, and because we are often afraid to talk about it, when young people are also not able to communicate with supposed elders who are in a better position to guide and provide them, guidance for them. They tend to turn to their peers who also probably also have wrong information, right? And then they pass that around themselves, and then we come down with this issue that we hear every now and again. Again, bottom line, safe sex is what you can do is to provide people with the information that they need, like I said earlier, for them to make the right or an informed decision. Now, you really cannot police somebody. You cannot follow somebody 24 hours of the day. So if you provide the information that they need for them to be able to also there's this what's the English for this now? Girls should be trained, right, or empowered to be able to have a conversation, to be able to negotiate some of these activities, because sometimes some people find themselves in the place where they are not sure what they need to do, or how to, if they find themselves in a compromising position, they are not sure how to get out of it. They don't know what they need to do. So we need to provide this guidance to these youngsters as much as is practicable. One thing that we need, that I am also guilty of this, of shying away from
having such
conversation with your children. So I think it's something that we need to come out of. The world has changed. You really cannot shield these people as much as you think that you are, because they go to school, you're not with them in school, they have access to their phones, everybody have access to the internet, and there are all manner of information flying everywhere. So we need to begin to have this conversation.
And they're very curious and looking to explore.
Very curious. Very, very, very curious. At there are places, there are some instances where a child innocently will ask a question and then you shut that child down. The child does not have an answer to that question, and shutting that child down does not remove the fact that that child is curious about that question that he or she has asked. That child is going to continue to look for answer, and he or she is likely going to get the answer from the wrong place.
Now, we're looking to have a holistic conversation. If you're just joining us, we're talking about the new year, new you. And away from the perspectives of economic prosperity, we're looking at your health, your well-being, and the concept of a balanced lifestyle in 2025. Dr. Matthew here has touched on it from the cradle at birth to the age of 2, the role of nutrition. He's also talked about it from the angle of substitutes to some of the proteins which you might say are very expensive. He's also refuted the claim that a balanced diet must be expensive. If you're looking to follow the conversation from the start, you can also revisit our YouTube channel to look at it. We're now looking at the roles of men, women in protecting their health. We've looked at teenagers as well. We'll look at one issue now that affects a lot of persons, but it's not being spoken about until people now delve into the use of psychoactive substances or drug. We're talking about your mental health. Now, owing to one issue or the other, people these days find themselves withdrawn. A lot of people exhibit signs of depression but are not early diagnosed till it becomes very chronic, and then you find out people are now slipping into alcohol abuse, drug abuse, or looking for a psychoactive substance to help their state of being because of their mental health. Doctor, how has society come to this point that people also stigmatize those that might be challenged when they perceive them not to be quite okay upstairs? If you understand what I mean.
That is a very big issue that we need to begin to address. Mental health issues. The fact is that mental health is just like any other health condition. It's only in Nigeria that it becomes a taboo for you to go and see a psychologist or to see a psychiatrist. They are like any other doctor that you have in the hospital. Like somebody going to the hospital to go and see a doctor because he or she has malaria, or because you have one infection or the other. There's no reason why any person who has mental health issues should feel frightened to go to the hospital to see a therapist. And given this stress that we find ourselves every now and again in this part of the world, mental health, we have issues of anxiety. Right? That is one thing that because anxiety that is not taken care of can further, spiral and become something else. So that is where, we start from. Somebody is anxious. again, we talked about, when we talk about stress earlier on,
Yes.
we did mention why people need to take time off to distress, because these are some things that can lead to people becoming, either because having issues of anxiety or having issues of depression. So, and people, once you notice that there's nothing wrong in going to the hospital, they are treatable, and you become fine again, and continue with your normal life. It becomes problematic when people refuse to go to the hospital, and then the person further declines, and they get to the point where people now begin to think about offing themselves. So.
Now, it's also from a certain demographic of people who also suffer from PTSD owing to their walk of life or their field of endeavors that has put them in such challenging position. And then you talked about your upbringing in the barracks. Most times it's also common amongst the men who give their lives to service to the nation. In other than speaking up about it, they begin to indulge in drug use or certain substances or concoctions that can help them keep their minds together. How do we have these conversations at that level?
So I think this is not, if you, recently in this, when the discussion about, kidnapping of people and, releasing people, you often hear the authorities say that they are debriefing them, right? You often hear them talk about them being in the hospital. So usually when people have gone through traumatic experiences, there's a standard protocol, right? One of which is assessing these individuals and making sure that whatever trauma, psychological or otherwise, that they have experienced while in captivity, or regarding whatever it is that has happened, is taken care of. That, so this is something that is should be institutionalized. This really. I'm not sure how much an individual is able to do concerning this, but the authorities that need to set up a system where people can be taken in. People who have had such issues can be taken in, and then they are properly debriefed. Part of which should include meeting with this therapist who is able to assess their state of mind and then decide what needs to be done, because it is unaddressed trauma that is that has been pushed back, because people try to repress such memories, but from every now and again things come up that tends to trigger that, brings it back to the consciousness, and then you begin to see those demonstrations. But if somebody has been properly taken care of at just post event, then the chances of this occurring is greatly reduced.
I'll use one scenario and to bring me to my next question, because in the FCT towards the end of last year, we saw task force going around trying to read the streets of what they called miscreants, in terms of those engaging in petty trading on the side of the streets or scampering or scavenging from dump sites. Before now, it was also done to people who were deranged and on the streets. But in terms of rehabilitation and reintegration of such persons in society, it's not so much of a conversation these days. You just find them at a certain bus stop or destitute under the bridge. I don't know if society can get back to the consciousness of trying to reintegrate such persons or salvage them from the streets like we see them.
So, when you say society now, not it's a broad categorization, right? But it has to start from somewhere. There needs to be I don't know if the government has a policy direction or policy statement, in that regard.
So before you go further, why I said society? Because most times you find families who are related to such persons shy away. They pretend as not knowing the individual. That's why I said society, because I think it's multifaceted. Families, the government.
So I think it's because of the stigma, that is associated with that. But like we said earlier, the fact is these people can be treated, right? So which is why I was going to the part of government. So if we have a structure where people are taken off the streets and then they are properly treated again, so the question will not be at whose expense, right? So that is probably where we will have challenge. But if the people are taken off the street and then they are institutionalized and given proper treatment, by the time they are well enough to be released or discharged from such institution, then they can be reintegrated back. I have a classmate secondary school classmate who experienced some a similar challenge. I mean, she was on the street for over 10 years. At some point, we came together as a old school association, and then we took her up the street, took her to the hospital, and today she's back. She's back home. She's reintegrated. She lives a normal, healthy life as we
10 years.
Yes, she was on the street for over 10 years.
Wow.
But today she's fine. In fact, you'll be shocked when you see her. You will not believe that this was the same person that was roaming the street. And
that's because you had concerned individuals, much like your association.
Yes. So that is what we. So if we have, such network, who, I mean, again, we keep talking about government because government is supposed to, set a direction, right? But they may not be able to do everything. So if there is a policy direction, right, that can guide people on what they need, what they can do or what they need to do, then, I mean, small groups of individuals can, because people, all these people that you just mentioned, they talked about on the street, they have relations, right? Possibly some of them may not even, some of these people may even, their relation may probably be looking for them because they probably just walked away one day and then they never saw them again, right? So I'm sure if they get to find out, some may be willing to, take them back and do whatever it is that they can do to, to get them back on their feet, so to speak. Of course, we know there are some that may want to shy away. I mean, we have people who hide people like this. You take them to one herbalist or so-called or a church somewhere, and then they are chained down, and because they do not know better, right? And they are trying to do their best. So if they know what they need to do, then I imagine that some people will be willing to do that. What is required is a direction that can help people make that decision and then do what they need to do.
We're almost coming to a close on our conversation, but we're trying as much as possible to touch all demographics and cover all groups. And one of such demographics where a lot of neglect is noticed in society is the aging and elderly. Doctor, when we come to this class of senior citizens, it's quite sad that you find out, much like you said, some families who take the crude method of trying to salvage people suffering from mental health issues. When it comes to the aged and elderly, a lot of people also are found to abandon this class of senior citizens. The conversation might be relegated to the backdrop. People don't talk about it too often. Just of late, we see that even in government, there's now an attention to that class of people with certain provisions for them. But how much of an importance is it, would I say rather, to attend to the aging and the elderly in society?
Extremely, extremely, extremely important. Very, very, very important. I mean, different societies have their different ways of looking after, the aged, right? Here in our climate, I mean, it used to be having them around their children, right? You take your mother or you take your father, and then you have them come live with you, right? Or you have people live with them. They are better off within their family circle. Now, if you see what I mean in advanced climate, what you see is that they have what they call old people's home, which is what we are beginning to tend towards that line right now, because with this Japa syndrome, people are not available in the country anymore. People are scattered all over the world, and we are now gradually moving away from having our aged parents properly taken care of. Because the fact is, social connection, people do not understand how important that is. If you look at the healthcare system in civilized times, you see that it is arranged so that apart from being in the hospital, there are setups that enables you to interact with people. Unlike I know that we are probably challenged with structures, resources, and all that in this part of the world. But you see, because the importance of that is that it does a lot to your mind in terms of helping to keep you healthy. That is also something that is very important for people who are who are aged. That social connection, being able to interact with others, is a very, very important component of continuing to maintain a healthy life, because it affects your mental health very seriously.
Well, I think as we're wrapping up the conversation, my last question to you is in setting agenda in terms of personal lives vis-a-vis our state of health. Just to summarize some of the key points we have highlighted in the course of this conversation, for viewers watching at home, what would be your message to them in parting?
So, very importantly, like we said, be mindful of your nutrition, and a very important component of that is proper hydration, drinking of water.
How many glasses is there? Is there a quantity to measure per day?
So the fact is, the amount of water required by an individual is dependent on, one, you as a person, your state of health, the environmental condition where you are, and a few other. But generally, we talk about needing 2 to 3 liters of water every day. But that 2 to 3 liters of water is not physically water that you drink, you gulp down, because the food that you eat, the beverage that you take, they in fact the greatest source of water that your body takes. But however, as much as you are able to drink, it is fine for you, so long as you are not taking more than 1 liter of water in an hour, because that is what your kidney is able to process properly, so that you don't suffer what we call water toxicity. So I've been taking the need for you to do regular checkup. It's very, because that is one thing that people take for granted. At least once every year, have yourself checked out, because most of the ailments that people come down with, particularly chronic conditions, they manifest very quietly without you knowing, right? So it's when you go to do your checkup that you are able to to find out that there's something going on that you need to take care of very quickly. They say prevention is better than cure. So beyond that, taking time to rest, like we mentioned earlier, and then distressing yourself. Once, just focus on these items: nutrition, hydration, exercise, then resting, and then
you're good to go for the year.
You're good to go.
Well, Dr. Matthew, thank you very much for your time on the program. We appreciate you for this objective guideline to a prosperous and a healthy 2025.
Thank you.